Women doctors are highly sought after as brides in Pakistan. They're seen as having both the qualities of working women and housewives, plus the status that comes with being a qualified medical professional. But there is a downside to all this. This Channel NewsAsia's Henna Saeed finds out.
Dr. Henna Pervez is a top student from King Edward Medical College in Lahore, one of the best medical colleges in Pakistan. But now the medicine field is, for her, limited to these books that she can't even read in peace.
They come here, they're very enthusiastic, but what happens is as soon as they get married, somehow something happens. Maybe it's the family pressure, maybe it's the in-laws' pressures.
In Pakistan, getting married to a doctor is every man's dream. Doctor brides are seen as the perfect mix of working women plus housewife. But more often than not, they end up leaving the profession to take care of the family and are resentful for it.
Whenever I go to any hospital, I just want to stay there. I don't want to come back home and do all the cooking and cleaning. I just want to go and practice and take care of patients.
Qualified women doctors are ending their careers prematurely and at an alarming rate. It's a story that's repeated in almost every household in Pakistan.
तरबियत भी और तालीम भी दोनों उनके लिए इम्पोर्टेंट होती थी और दोनों पे तवज्जो दी जाती थी, लेकिन अब वो इस वक्त इसी चीज़ पे कि जी हमारी बच्ची डॉक्टर बने और जो हम बहू लेकर आएँ वो भी डॉक्टर हो.
It used to be that the perfect bride had to be tall, have fair complexion, a charming personality and come from a good family. Now she will either need an MBBS degree or be a qualified dental surgeon.
It's a social status kind of a thing that people present that she's my daughter or daughter-in-law and she's a doctor. But at the end, I think if they only want a doctor bahu or a doctor girl to be gold rotis for them, for the family, I don't think so they should prefer a doctor girl.
Dr. Hira remains a practicing dentist, but she's not married yet. There are many more women than men enrolled in Pakistan's medical colleges. The ratio is roughly 70 to 30. This means Pakistan is likely to lose up to 70% of its doctors after marriage, creating a shortfall in the industry. Some say the solution is to have medical students serve a bond to practice for a minimum period of time so their training will not be wasted.
There's nothing being done to counter this gap. What they should do is they should have a bond filled by these girls and even boys that they will work for at least 2 years.
Medical experts even suggest that Pakistan set a quota for the intake of women into medical colleges that will reduce loss to the profession when they eventually stop practicing. More than that, the society will have to understand that doctor brides may bring a family status, but a medical degree is not a qualification for a better family life. Henna Saeed, Channel NewsAsia, Lahore.